Medicare enrollment sounds simple. You turn 65, sign up for Medicare, and you're done. But for many people, it doesn't work quite that way. Maybe you're already receiving Social Security when you turn 65. Maybe you're still working and covered by an employer health plan. Maybe your coverage comes through your spouse. Or perhaps you've retired and are using COBRA. Each of those situations can affect when you should enroll in Medicare. And getting the timing wrong can have consequences. You could go without health coverage for a period of time. You could miss an opportunity to enroll when you expected to. And in some situations, you could face a late enrollment penalty that follows you for years, or even for as long as you have Medicare. The confusing part is that Medicare doesn't have just one enrollment period. There's an initial enrollment period when you first become eligible. There are special enrollment periods for certain circumstances. There's a general enrollment period. And then there are annual opportunities to change Medicare Advantage or prescription drug coverage. Those periods sound similar, but they serve very different purposes. In this retirement briefing, we're going to organize them into a simple timeline. We'll explain when you normally enroll around age 65, what changes if you're still working, which types of coverage may allow you to delay Medicare, and which types may not. We'll also explain the late enrollment penalties for Medicare Parts A, B, and D, and how to avoid them. Then, toward the end, we'll walk through several real-life examples so you can see how these rules work in different retirement situations. Because with Medicare enrollment, the most important question isn't simply, am I eligible? It's also, when do I need to act? Let's start with the enrollment window most people encounter first, the 7-month initial enrollment period around age 65. For most people, the first Medicare deadline to understand comes around age 65. It's called your initial enrollment period. This is a 7-month window. It begins 3 months before the month you turn 65, includes your birthday month, and continues for 3 months afterward. Here's a simple example. Suppose you turn 65 in September. Your initial enrollment period begins in June and runs through December. But just because you have 7 months doesn't mean you should wait until the end. If you enroll in Part B during the 3 months before the month you turn 65, your coverage generally begins the month you turn 65. If you enroll during your birthday month or during one of the 3 months afterward, your coverage generally begins the following month. So if you need Medicare coverage as soon as you're eligible, starting the process before your birthday month can help you avoid an unnecessary gap. There's another important question. Do you actually have to sign yourself up? That depends partly on whether you're already receiving Social Security benefits. If you're receiving Social Security benefits before age 65 and live in the United States, you're generally automatically enrolled in Medicare Part A and Part B when you become eligible. Medicare sends information about your enrollment before coverage begins. Part B has a monthly premium, so you can decline it. But don't decline Part B simply because you don't think you need it yet. Whether delaying Part B is safe depends on the type of health coverage you have. We'll deal with that in the next chapter. If you're not receiving Social Security benefits when you approach 65, don't assume Medicare enrollment will happen automatically. You generally need to take action yourself. And you do not have to start collecting Social Security retirement benefits just to enroll in Medicare. You can apply for Medicare separately while continuing to delay your Social Security retirement benefit. One more detail is easy to miss. If your birthday falls on the first day of a month, Medicare treats the timing differently. Your eligibility and coverage can begin in the previous month, so your enrollment timeline also shifts earlier. The practical lesson is simple. Don't wait until your 65th birthday to start thinking about Medicare. About 3 months before your birthday month, determine whether you'll be automatically enrolled, whether you need to enroll yourself, and what other health coverage you'll have when Medicare begins. For many people, that's all they need to do. But what if you're turning 65 and you're still working? Or you're covered through a spouse who's still working? That's where Medicare enrollment becomes more complicated, and that's what we'll cover next. What if you turn 65 but you're not retiring? Maybe you're still working and have health insurance through your employer. Or perhaps you're covered through your spouse's job. In some situations, you may be able to delay Medicare Part B without paying a late enrollment penalty. But there's an important phrase to remember: coverage based on current employment. If you or your spouse are still working, and you're covered by a group health plan based on that current employment, you may qualify for a special enrollment period. That can allow you to enroll in Part B later without the normal late enrollment penalty. You can generally enroll while you're still working and covered by that employer plan. And when the employment or qualifying employer coverage ends, you generally have an 8-month special enrollment period to enroll in Part B. But don't automatically assume that every employer plan allows you to delay Medicare safely. Employer size can matter. For someone who qualifies for Medicare because of age, if the employer has 20 or more employees, the employer group health plan generally pays first and Medicare pays second. That can make delaying Part B a reasonable option for some workers. If the employer has fewer than 20 employees, Medicare generally pays first. That means you should talk with the employer's benefits administrator before deciding to delay Part B. Otherwise, you could discover that the employer plan expected Medicare to pay first, even though you never enrolled. Now let's look at one of the most important traps: COBRA. Suppose you retire at 66 and your employer offers you COBRA coverage. You might think, I still have my employer's insurance, so I can wait until COBRA ends before enrolling in Part B. That could be an expensive mistake. COBRA is generally not considered coverage based on current employment for the Part B special enrollment period. Your 8-month Part B enrollment window is generally tied to when your employment or qualifying job-based coverage ends, whichever happens first. Taking COBRA does not restart that 8-month clock. Retiree health insurance creates a similar concern. Coverage from a former employer may be valuable, but retiree coverage isn't considered coverage based on current employment for this Part B special enrollment period. In fact, some retiree plans expect you to enroll in Medicare when you're eligible and then coordinate their benefits with Medicare. So, before delaying Part B, ask a very specific question. Is my coverage based on current employment, and does it allow me to delay Medicare Part B without a penalty? And get the answer from your employer or benefits administrator rather than assuming. There's one more issue for people working past 65: health savings accounts, or HSAs. Once you're enrolled in Medicare, you can no longer contribute to an HSA. And if you delay Medicare and later enroll in premium-free Part A, your Part A coverage can sometimes be retroactive for up to 6 months, but not earlier than the month you first became eligible. That retroactive coverage can affect HSA contributions. So, if you're working past 65, contributing to an HSA, and preparing to enroll in Medicare, don't wait until the last minute to investigate the rules. The larger lesson is straightforward. Working past 65 does not automatically mean you can delay Medicare. What matters is the kind of health coverage you have, whether it's based on current employment, and how that coverage coordinates with Medicare. Before you delay Part B, verify those 3 things. Next, we'll look at what happens if you miss your original Medicare enrollment opportunity. And we'll separate the general enrollment period from the annual Medicare open enrollment periods, because they are not the same thing. Medicare has several enrollment periods with very similar names. And that's a problem because they don't do the same thing. Let's separate three of the most important ones. First is the general enrollment period. This runs from January 1st through March 31st each year. Think of this primarily as another opportunity to enroll in Medicare Part B or Premium Part A if you missed your earlier opportunity and don't qualify for a special enrollment period. If you enroll during the general enrollment period, your coverage generally begins the first day of the month after you sign up. But using the general enrollment period doesn't automatically erase a late enrollment penalty. If you delayed Medicare without qualifying coverage or another exception, a penalty may still apply. We'll explain those penalties in the next chapter. Now compare that with Medicare open enrollment. This happens every year from October 15th through December 7th. This period is mainly for people who already have Medicare and want to change how they receive their health or prescription drug coverage for the following year. During open enrollment, you can switch from Original Medicare to Medicare Advantage. You can switch from Medicare Advantage back to Original Medicare. You can change Medicare Advantage plans. And if you have Original Medicare, you can join, drop, or switch a Medicare Part D prescription drug plan. Changes made during this period generally take effect January 1st. So remember the distinction. The general enrollment period can help someone who needs to enroll in Part B after missing an earlier enrollment opportunity. Medicare open enrollment is primarily about changing Medicare health or drug coverage you already have. And then there's a third period, the Medicare Advantage open enrollment period. This also runs from January 1st through March 31st, but it's specifically for people who are already enrolled in a Medicare Advantage plan. During this period, you can make one change. You can switch to another Medicare Advantage plan or leave Medicare Advantage and return to Original Medicare. If you return to Original Medicare, you can also join a separate Part D drug plan. But if you already have Original Medicare, this period does not give you an opportunity to switch into Medicare Advantage. 3 periods. 2 of them even share the same January through March dates. So don't rely on the words open enrollment alone. Always ask, am I trying to enroll in Medicare Part B because I missed an earlier opportunity? Or am I already enrolled in Medicare and trying to change my coverage? Knowing that difference can point you toward the correct enrollment period. Next, let's talk about what can happen when Medicare enrollment is delayed too long. The late enrollment penalties for Parts A, B, and D. Now let's address one of the biggest reasons Medicare enrollment timing matters: late enrollment penalties. These aren't simply one-time fines for missing a deadline. Depending on the part of Medicare involved, a penalty can increase your monthly premium for years, and in some cases for as long as you have that coverage. Let's separate Parts A, B, and D. First, Part A. Most people don't pay a monthly premium for Part A because they or their spouse paid Medicare taxes for enough years. If you qualify for premium-free Part A, the Part A late enrollment penalty generally isn't an issue. But some people have to buy Part A. If you have to pay a premium for Part A and don't enroll when you're first eligible, your monthly Part A premium may increase by 10%. Unlike the Part B and Part D penalties, however, this penalty doesn't necessarily last for life. Generally, you pay the higher Part A premium for twice the number of years you delayed enrollment. So if someone delayed Premium Part A for 2 years, the higher premium would generally apply for 4 years. Now let's move to the penalty that affects far more people. Part B. If you don't enroll in Part B when you're first eligible, and you don't qualify for a special enrollment period or another exception, your premium can increase by 10% for each full 12-month period you could have had Part B but didn't. And this one can be costly because, in most cases, you pay the penalty for as long as you have Part B. Here's a simple example using 2026 figures. The standard Part B premium in 2026 is $202.90 per month. Suppose someone delayed Part B for 2 full years without qualifying for a special enrollment period. That would generally mean a 20% late enrollment penalty. Using the 2026 standard premium, the penalty would add about $40.60 per month, bringing the monthly Part B premium to approximately $243.50. And remember, the standard Part B premium can change from year to year. The penalty is calculated as a percentage of the applicable standard premium, so the dollar amount you pay can change as well. Now let's look at Part D prescription drug coverage. Part D works differently. After your initial enrollment period, you may owe a penalty if you go 63 days or more in a row without Medicare drug coverage or other creditable prescription drug coverage. The word creditable is important. It means the drug coverage is expected to pay, on average, at least as much as standard Medicare drug coverage. Employer or union drug coverage may be creditable, and certain other coverage may qualify as well. Your plan should tell you whether your prescription coverage is creditable. Keep that notice. It can become important later if Medicare needs proof that you weren't without qualifying drug coverage. The Part D penalty is calculated using 1% of the national base beneficiary premium for every full month you went without creditable drug coverage. For 2026, that national base beneficiary premium is $38.99. So, for example, if someone went 14 full months without creditable drug coverage, the penalty would be 14% of that base amount, about $5.50 per month in 2026 after rounding. That may not sound enormous, but the penalty is generally added to your premium for as long as you have Medicare drug coverage. And because the national base beneficiary premium can change each year, the dollar amount of the penalty can change too. There's an important exception. People who qualify for extra help don't pay a Part D late enrollment penalty while they receive that assistance. So, what's the larger lesson? Don't decide to delay Medicare simply because you're healthy, rarely visit a doctor, or don't currently take prescription medications. The enrollment rules aren't based on whether you expect to use the coverage. They're based on when you're eligible and whether you have qualifying coverage that allows you to delay enrollment. Before deciding to postpone Part A, Part B, or Part D, confirm that you understand what happens when your current coverage ends. Because avoiding a late enrollment penalty is usually much easier than dealing with one afterward. Now let's put everything together with a few real-life examples. We've covered a lot of enrollment rules. Now let's put them into real-life situations. These scenarios are simplified, but they show how Medicare enrollment timing can affect very different retirees. Scenario 1. Robert retires as he turns 65. Robert turns 65 in September and plans to retire at the end of August. He won't have employer health coverage after retirement. His initial enrollment period begins in June, 3 months before his birthday month. Instead of waiting until September, Robert enrolls before his birthday month, so his Medicare coverage can begin in September. For Robert, the process is relatively straightforward. He knows his employer coverage is ending. He knows when Medicare needs to begin, and he acts before there's a gap. Scenario 2. Linda keeps working past 65. Linda turns 65 but plans to continue working until age 68. She's covered by a group health plan through her current employer, which has more than 20 employees. Linda checks with her employer's benefits administrator and confirms that the employer plan remains primary while she's working. She decides to delay Part B. 3 years later, Linda retires. Because she had qualifying coverage based on current employment, she can use her special enrollment period to enroll in Part B without the normal late enrollment penalty. The important part isn't simply that Linda was working past 65, it's that she verified the type of coverage she had before delaying Medicare. Scenario 3. James retires and chooses COBRA. James retires at 66 and elects COBRA coverage. He assumes that because COBRA continues his former employer's health insurance, he can wait until COBRA ends before enrolling in Part B. That's where the problem begins. COBRA isn't coverage based on current employment for purposes of the Part B special enrollment period. James's Part B enrollment clock doesn't wait for his COBRA coverage to end. If he waits too long, he could miss his special enrollment period, have to use another enrollment opportunity, and potentially face a Part B late enrollment penalty. The lesson from James is simple. Continuing the same health insurance is not necessarily the same as having coverage based on current employment. Scenario 4. Susan delays Part D. Susan enrolls in Medicare, but decides she doesn't need Part D because she doesn't take any regular prescription medications. She also doesn't have other creditable prescription drug coverage. She remains without qualifying drug coverage for more than 63 consecutive days. Later, Susan develops a condition requiring regular medication and decides to enroll in a Part D plan. At that point, she may face a Part D late enrollment penalty based on the number of full months she went without creditable coverage. Susan's mistake wasn't being healthy. It was assuming she could wait indefinitely to get drug coverage without consequences. So, what should you take away from these 4 scenarios? Here's a simple Medicare enrollment checklist. First, about 3 months before you turn 65, determine whether you'll be automatically enrolled in Medicare or whether you need to sign up yourself. Second, if you're still working, don't assume you can delay Part B. Ask whether your insurance is based on current employment and how your employer plan coordinates with Medicare. Third, if you're leaving a job, pay attention to the Medicare clock even if you're offered COBRA or retiree health coverage. Fourth, if you're delaying Part D, make sure you have creditable prescription drug coverage and keep the notice proving that coverage was creditable. Fifth, if you contribute to an HSA and you're approaching Medicare enrollment, check the Medicare and HSA timing rules before making additional contributions. And finally, don't wait for a deadline to discover that your situation is more complicated than you expected. Medicare rules can depend on your employment, your spouse's employment, your existing insurance, and the type of Medicare coverage you're choosing. If you're uncertain about your situation, you can contact Medicare, Social Security, or your local state health insurance assistance program, known as SHIP, for personalized assistance. And remember, the goal isn't simply to enroll in Medicare, it's to enroll at the right time, maintain the coverage you need, and avoid penalties you didn't need to pay. If this retirement briefing helped make Medicare enrollment easier to understand, please consider subscribing and sharing it with someone approaching Medicare eligibility. Because a little planning before age 65 can prevent a much more expensive problem later.